changed course during my last couple of years there, and went off to graduate school to get my master's of public health and epidemiology after I graduated. And I got my first job at the Volusia County Health Department as a new epidemiologist in January of 2009. And I had just about remembered how to find the bathroom when this novel flu virus emerged. And my main job was acting as the influenza epidemiologist. So I had about a month and a half experience under my belt as an epidemiologist, and I was leading the charge to respond to this novel H1N1 flu virus. So it was definitely baptism by fire, but I learned so much in such a short amount of time that it would have taken me years to learn that had I not been thrown into the fray immediately. I worked for the health department for a few years and decided I needed to punish myself some more for my Ph.D. And so I transitioned out of applied public health and into academics. As I worked on my PhD, I taught undergrad epidemiology courses at UCF, and commuted back and forth between Orlando and Tampa. Eventually, I ended up advising all of the students in the online Master's of Public Health Epidemiology program for several years at USF while I finished my degree. And then after graduation, I worked as visiting epidemiology faculty at USF and became the concentration lead for the online MPH program in epidemiology. So at one time, I was faculty mentor to about 50 students, teaching classes, doing research, all of those things, so full plate. After a short stint as the program analyst for Easter Seals, Florida, I ended up in my current position, and no one knows what I do based on my title. So the Health Sciences Collegiate Academy is a partnership between Lake Sumter State College and the Lake County Schools to provide a dual enrollment opportunity for high schoolers, highly qualified high schoolers who are interested in health sciences or STEM careers and are university and graduate school bound. So it's exciting to work with those students, and I've had a few of them come and tell me now with all of this COVID stuff that they've decided they want to become epidemiologists. So they're changing their plans to head off to programs of public health. And since we feed into universities at the undergrad level, I've been trying to sell these students on undergrad public health programs since they have a little while to go before they reach graduate school. So that's basically my path after Stetson in a nutshell.
Great, thank you for sharing that. So we have a few questions that'll help with the discussion this evening, and the first one would be for Michelle. Is the current frontline epidemiology infrastructure equipped to handle situations like COVID-19?
The answer is no. The workforce, well, public health has chronically been underfunded, and so the number of positions, especially frontline epidemiology positions, dwindle each year. And of course, we don't really pay attention to that until something like a pandemic like COVID-19 comes through and completely overwhelms the staff in place. Really just normal outbreaks that occur through the year can overwhelm the limited staff that are in health departments now. And so in addition to increasing the number of positions, we really need to train more epidemiologists and train more frontline epidemiology staff, which leads us back to this discussion tonight about the importance of public health education and training those frontline workers. So much, traditionally, an epidemiologist would have to obtain a master's degree or higher to go work in those frontline positions. That's not necessarily a need, as Dr. Johnson and I have discussed. We believe that undergrad bachelor's programs could prepare those frontline workers to go right into the field after their 4 years of school, rather than tacking on an additional 2. And I know Dr. Johnson has a lot of thoughts about this, so I'd love to turn it over to her. I've been talking a while.
Well, thank you, Michelle. It's very good. I always love to hear from our students, and we have our alumni about their journey to where they are right now. It's always very much enjoyable to hear from you and others. Like as you said, I also want to emphasize that the answer to that question, whether or not we're ready right now, are we equipped to deal with this situation? The answer, as you said, is no. And there are so many different different layers of explaining why we are where we are right now. And one of that is we are, as you said, we are very much understaffed. So the report just came out about a month ago from American Public Health Association, saying that overall we have 250,000 shortage in public health staff. This is nationally, this is a huge number. And the reason we are facing this shortage of staffing in public health is because in different states and in different counties around the country, when there is any budget cut, public health is one of the first that goes, right? And this is something I always tell my students, that a lot of what public health does and what it does really successful, when it's successful, people take it for granted. It's invisible. People do not see this wonderful workforce who are working in the background or behind the scenes. Now that we are all sitting in our houses, we know that we cannot take for granted the fact we can safely, every day we can safely go to our works, we can safely go to restaurants and eat our food and nothing happens. So all that safety that we've had up to 2 months ago was because of the wonderful job of public health people and epidemiologists who's been done in the background, and and it was invisible to us. It became visible after the COVID-19, or sometimes when there are these controversial public public speaking attention, basically outbreaks that happen, such as the other pandemic, H1N1 pandemic in 2009, for example. When these things happen, then the public pays attention, and then public health becomes visible. And I've always said the biggest enemy of public health is public health success. When it's successful, people take it, and all politicians as well, or policymakers take it for granted, so they cut budgets. And when the budget is cut, then the human resource goes away, that means staffing goes away. So when something like this happens, we are not prepared, right? We could have done better if we had more frontline staff in place when that happens. We are here for some part because we have not invested in public health, and in a more specific term, in epidemiology.
I completely agree, and I believe there will be an explosion in physicians over the next year or so, created due to this pandemic, which is wonderful, but it's a opportunity for education to really figure out how to train the next class of those frontline epidemiologists. I think it's an opportunity for schools like Stetson and other universities who haven't necessarily had very robust public health programs to really build those up. I think they will. I think you'll definitely see increased enrollment, as evidenced by these few students who have come to me in high school and said, this is what I want to do now because I've seen them on the news. It's a great opportunity, and I think that you should really take advantage of it. And I know we talked about how you really wanted to develop Stetson's public health courses and public health curriculum to produce these frontline workers, which I think is wonderful. When I did work in local public health, as I said, everyone had at least a master's degree or higher. And as we think about expanding local public health departments and the education that's required to fill those roles, I don't necessarily think that everyone needs to have a graduate degree, especially if you're talking about filling the recommended filling departments according to the recommended capacity of one epidemiologist per 100,000 population. That can get pricey to pay for so many staff members with a graduate degree. If you have one or two people on staff that have that higher level training, the analytic skills, I do think it's a very viable option to consider hiring bachelor's trained public health employees to do the contact tracing and interviews with cases, because of course COVID-19 is not the only situation where that happens. That's what epidemiologists in the local public health department are doing every day. There's something like 94 reportable conditions in Florida, and all of those require follow-up. Plus the normal outbreaks that occur throughout the year. So I think that this is a good opportunity for programs of public health to rethink the type of student that they're trying to reach and develop coursework based around what the future job market might look like.
Yes, just again to build on what you wonderfully said, it's really important to know that even if students want to go to graduate school, it's always in public health. Public health is a very practice-oriented, basically discipline, even if people have master's degree. And even if students want to go to graduate schools, if they have 1, 2, or 3 years of experience in the field before going to graduate school, that would really increase their chance of getting into very competitive graduate school. And just for an example, I would say Johns Hopkins University, you won't be even eligible to apply for their MPH program unless you have your bachelor's degree plus 2 years of experience in the field of public health. So because experience in the field of public health is very valuable, even for those who want to go to graduate school. And then one thing else, again, I just want to add to what Michelle wonderfully articulated, is that like there are several different things epidemiologists can do, and one of them obviously now that is basically the conversation topic of every household. We all know that epidemiologists do a lot of modeling. They can model disease. They can, based on the data that they look at, they can basically project if the disease is going to go, even if it's cancer, it doesn't need to be infectious disease. If the project basically the direction of disease, the increase or decrease in disease in future or in near future. So these are a little bit more advanced analysis that people with graduate level degrees could do. But a lot of times we also need people who do field work in epidemiology, as Michelle said. In this case, contact tracing is one of them. And now I know that everybody talks about COVID-19, but Central Florida has been struggling with hepatitis A outbreak for a while right now. One of the main reasons they have not been able to get under control is actually staffing issues. So if we can basically train students who are able to do this level of field work and basically learn a little bit of more advanced analysis for graduate people to work for the Department of Health. That would be a wonderful contribution of undergraduate institutions to this whole entire world of public health and the safety of our society and our nation.
I agree with that. I was a proponent at USF of rethinking our epidemiology track at the master's level to have a practice-based track and a more analytical track, because my experience, and I wasn't alone in this, 12 years ago, when I finished my degree and went to work and on the front lines at the local level, I felt very unprepared for the contact tracing, the field work piece of it. I'd had a little bit in my program, but most of it was statistical modeling and learning how to do different types of regression analyses and study design and things like that, which you use sometimes at the local level on the very front lines, but not as much as those other fieldwork methods. And I was, and I had some faculty on my side and others who were skeptical of my over at USF about doing that, but I really think it would benefit students and it would benefit public health to really have these two different tracks with a little bit of intermingling. Every epidemiologist should understand some basic data analysis, but if we can career coach students and figure out which path they want to take, I think that's better than just assuming every single epidemiology student is going to go work for the pharmaceutical companies and do data analysis. That just isn't how it works out. So I think it's really a good opportunity to rethink how we deliver epidemiology training. Just because it's always been done that way doesn't mean we have to continue doing it that way. And I don't know if we come, I haven't been paying attention to the time, so I don't know if it's time for questions or not.
Well, we certainly always welcome questions. If anybody does have any, feel free to put them in your chat. For both of you, I guess, what is something that our attendees can do to take action during right now to support future epidemiologists, to support Stetson, to support both of you in your efforts moving forward during COVID and in general?
Would you like me to go first? You can vote for public health and support public health education. Public health, especially frontline epi folks, just as important as any of the other members of public protection, fire, and police. And as Dr. Johnson said, they are invisible until something bad happens. So we have to remember them even in the good times. So to support public health and education.
I would say that would be wonderful if you all can stay connected with Stetson, but mostly you can stay connected with our public health program. You know, our students will very much appreciate the involvement of our alumni and see how they are interested in this newly, basically, our program, our major is new. So this is a new program. That would be wonderful if you could, any way you could support the public health program. It is, as far as I know, in Central Florida, there's no other undergraduate public health, just Stetson University. So if you could just support it, that would be wonderful. We're ready for questions.
Yes. Yes, if anybody has any questions, feel free to drop them in the chat box. I see, let's see. Yes, Alex mentioned he was going to ask how alumni can continue to make sure this continues so that we get proper attention even after the current pandemic is over. So he supports your points and says you have great points.
Well, Alex, yeah, and then you make an excellent point. It's just not about the current pandemic. So public health is an ongoing situation. There is just so much about vaccination, for example, vaccination and getting children, vaccinated. That is, that's a huge undertaking for public health practitioners out there. And as you guys may know, it has its own challenges. So when the level of vaccination gets down, then we have measles outbreak right now. Measles once was considered an eliminated disease in the United States. We have to constantly keep our eye on malaria. Malaria is eliminated from the United States. But if it is prevalent in the other parts of the world, it can be reintroduced to the US and other areas. So there's just so many basically disease threats out there. And now everybody's familiar with emerging diseases. There are these new diseases that are a different beast for themselves. So what that means is that is public health, the interest in public health should never stop. It's an ongoing issue, and we should always be invested in that. So, and I always believe that we can do our own share at undergraduate institutions. Law universities can do their own share. Basically departments of public health can do their share, but also residents and citizens of the country and the counties can do their own share to make sure that they keep the official accountable, to make sure that they do the right investment in the discipline of public health. It should be a non-partisan issue, basically. It's public health. It's for the safety of everyone.
Yeah, I would add, just educate your different sectors. No one knows what an epidemiologist is. They think you're a skin doctor.
Yeah, dermatologist. But the pandemic has helped that.
A little bit, yes.
Yes. Yes, thank you, Alex.
Great comment from Alex. Yes, thank you, Alex. Well, if nobody has any more questions, I'm guessing, is there a final comment either one of you want to leave us all with this evening?
Well, I just appreciate you inviting me. Oh, wait, we have another question.
We do. There we go, Jackie. So Jackie asks, what material do you have to share about epidemiology across different age groups?
Michelle, you want to go with that? If you want to go with that.
I'm not quite sure what the question is asking.
Jackie's asking about the material to educate people about epidemiology. I think is that right, Jackie? Did I get it correctly?
She's not responded yet. Yes, okay. To Dr. Johnson, yes.
Actually, like if you go, there are K1 to 12 materials that the CDC has put together. It's called Young Epidemiology. Some of them are very engaging. We could put together games and very interesting games actually about outbreak investigation, how to solve outbreak mysteries. It's like a clue game, right? I always tell my students, outbreak investigation is like a clue game. And to reach that age group, basically younger populations, and obviously when we go to college level, there is more advanced material to share to educate. college education, basically crowd. But in general, there is, again, I want to go back to the CDC. The CDC has really good material for the public, regardless of your education, your background, to have some basic knowledge about epidemiology. I also want to point out something, and I just want to be honest. As I read so much about this pandemic and what is being shared on social media, I have realized some people, even with very advanced degrees, like some people with PhDs or with graduate level, but in other fields, right, non-public health fields, the literacy about education and public health is pretty low. I think generally our national literacy about public health overall, also epidemiology in particular, is not that great. And that has really made me thinking about rethinking our college education to a certain degree, that everyone, no matter what is your discipline, what is your field that you're studying, what is it that you're interested in, as long as you have a college degree, you should have some basic understanding of public health and epidemiology. Because now, as you see, it is really important. And what I think one of the reasons misinformation is spreading so fast, and in my view, is more dangerous than the disease itself. It really makes the control of disease a lot harder than it should be. It's because people are not very knowledgeable about the thing. So I think so much work needs to be done from the educational standpoint. Like in detail.
I think it would be useful to incorporate it into the high school curriculum, and then maybe college if they haven't had it in high school, because as you were saying, so few people really understand it or know about it, and I think it's just lack of exposure to it at an earlier age or earlier on in their education. And if you integrate it into high school curriculum, then you're not only reaching those who made it to college. And I know CDC has some nice high school curriculum for teachers to use. So I think the content is there. It just needs to be executed.
Yes, and then you're right. The high school, even if the high school may not be bad, because even not that everyone goes to college, right? So that everybody would know. And I know that we try to learn to teach science to like K1 to 12, and epidemiology science too. Maybe this could be one portion of that science, that the health sciences basically, that is taught to people before college as well. Yeah. I agree. Yes, Livia, I agree.
Yeah, I agree, Livia. I haven't been there long enough to fully integrate it, but I have plans for that.
I see you all reading Alex's comment.
Yes, I was reading the Alex. So Alex, I also got a good question from Sue, but Alex, yes, there are actually, I did put together like a resource center just for COVID-19, but there are general really good articles. I think, Alex, you're talking in general about public health, right? Not just COVID-19. Am I right?
I think so. Yeah.
If it is, yes, there are, and there are sources we can share, but we can also be more intentional about that and share, create some basically fact sheet that is more specific about maybe tied to Stetson program and then share that. But there are also general materials and sheets that can be shared. I'll be happy to work with our alumni association with that. And there's Sue's question. So yes, Sue, public health is a broad field, and if they want to focus on pandemic, well, let me tell you something really interesting. I was supposed to teach a class specifically on COVID-19, and I think if that class was offered 2 or 3 months ago, there would be a lot of students in it. But right now, because the class did not get enough attention, the class was canceled. And I think as of right now, a lot of our students are experiencing fatigue over these pandemic issues, because you turn on the TV, you hear about it, from every corner you're hearing about it, and people need to have a break, to get their break from it. I think psychologically. So, but I think in general, the field, there are so many, big chronic disease is a very huge, we have huge problems, diabetes, with cancer, and with other issues in this country, like heart disease. But I also think undergraduate education in general is now paying attention to infectious disease. As you see, infectious disease is not over. In industrialized countries, it's just as important as it was 100 years ago, but with new challenges. So I have a feeling students might be more interested in infectious disease epidemiology, which is a very good thing.
And that's always been my experience with incoming MPH students. Infectious diseases is like the sexy gateway drug to epidemiology. They all want to be infectious disease epidemiologists. And then once they start to progress through their program and they're exposed to chronic diseases and different topics within epidemiology, the light bulb kind of goes off for a lot of them, and they say, oh no, I don't want to do that. I want to go work in this field. But so many of them want to be infectious disease epidemiologists when they come in.
Yeah, it is a hot field. It draws students' attention, but now that they see how relevant it is, there is student attention, but there is not a lot of curricular connection to that interest in undergraduate public health. There is this misperception that infectious disease is not our problem in the U.S. Our problem is usually cancer. Our problem is usually heart disease, which is true. But we also have to deal with HIV. We have to deal with hepatitis C. We have to deal with hepatitis B, and now there are hepatitis C outbreaks. I mean, all kind of vaccine preventable diseases. We still have to deal with all that. So infectious disease is still very relevant, and it remains relevant, and I think it may actually gain more relevant because of emerging and novel diseases that they're becoming more and more common, unfortunately. Thank you, Christine, for your comments. I really appreciate your comments.
Yes, Christine had a great comment, and a kudos to both of you for all of your hard work and your participation this evening as well. I know a lot of people have definitely enjoyed hearing more about your topic, and we are a little bit out of time, but if anyone does have one more question, I know everybody will be hanging out. I'm sure everybody's getting ready for the rest of their evening, but I know Michelle and Asal will be able to hang out in case there are a few more questions. But I don't want to keep everybody. Alex definitely says thank you and would love to chat with everybody offline. So that's a perfect segue into throwing your contact information up there. So if anybody does want to contact our experts, they certainly can. So we have their email address for both of them up on the screen, and we will share that also in follow-up email. So everyone will get a follow-up email with the slides, the contact information, and some other things that we'll send out via email. So I definitely want to thank you both for taking your time this evening. out of your busy schedules, end of semester for both of you, with everything going on. We appreciate it. And
I want to thank everyone too, and please, if you would want to email me, please feel free to email me. I'll be more than happy to stay in touch with all of you. And also, I want to thank all of you for your interest in this panel and for inviting me.